dummy, dummy, be smart. He said that fool, you weren't cool. He took a book to your school. Be smart, dummy, dummy, be smart. Don't get shocked if you get mocked. It's what you find when you use your mind. Don't you sweat it, look 'em in the eye. Don't regret it, hold your head high. Be smart, dummy, dummy, be smart. Try to show some tenderness, even when they're playing chess. You think it's dumb to be smart? But that's the way you make art. So be smart, dummy, dummy, be smart. Use your brain, that's a start. It's okay to be smart. Don't you think that you are cool? Sorry, dummy, the joke's on you.
Hi, I'm James E., and this is Change Your Mind. I live in the divided states of America. And how do we become united again? Well, unity is not uniformity. We do not have to look alike, dress alike. We don't even have to think alike. We spend so much time trying to change other people's minds, but we don't think about changing our own. We're not taught how to do so. So this show is showing you that I can change my mind. And today's topic is the U.S. healthcare system. And I throw up my hands in despair. I think that the politicians that make policy are dependent upon contributions from the pharmaceutical and insurance industries, and they don't want to get primaried when they run again, so they basically don't take on these industries, and we're stuck with a healthcare system that doesn't provide the kind of healthcare that we deserve and the kind of healthcare that this country can provide. However, we pay so much for it. So the cost is exorbitant. Some people go bankrupt due to medical expenses. And this is a tragedy in the United States that we hear and see too often. And so although I hate to just throw up my hands in despair, so I brought a guest on today to help me regain some hope. And my guest today is Shaquille Latimer. Shaquille, thank you for joining me.
Good morning. Thank you for having me.
You bet. And Shaquille, I know that you're of Indian descent. You were born in Fiji and you live in Australia, but you travel the world.
I was born in Australia. My parents were born in Fiji.
Oh, I see. I'm sorry. Got that wrong. So fact check me right away. But because you've been exposed to many other types of healthcare systems, I wanted your opinion about what can the U.S. Healthcare system do better? How can it change? Can it get better? I guess is my first question.
Look, it can. I'm afraid I might agree with you about the politics. I wish that they had a bit more backbone. But look, I think it can, and I think there could be enough pressure put on it. Look, I've been very fortunate in my life to have been able to travel the way that I have. So I'm a citizen of Australia. I'm a citizen of Britain. They both have, in the eyes of Americans, universal health care, but they're a little bit different. So in the UK, for example, it's just the government pays for everything through the national insurance. Then you have various systems throughout Europe. Most of them are fairly similar. Switzerland, which is the country I think we'll focus on during today's talk, while we're talking today, has a very interesting system that I think the US should have a look at. Australia has an interesting system. Now, New Zealand, you go to the doctor, you actually normally get your medicine from the doctor. You don't then have to go to a pharmacy. In a lot of cases, the doctor will give it to you and it's part of your consultation. And my understanding is, and I could be wrong about this, but my understanding is when the doctor gives you a prescription, if the doctor doesn't have the medication for you and you go to the pharmacy, the medication's already covered. You don't have to pay for it. It was already part of your consultation. So that's an interesting system. Obviously, I've spent some time in Canada, and then I've spent some time in the good old US of A.
Uh-huh.
And I've interacted with the USA healthcare system to a minor degree on health and certainly a major degree on dental. I've got some pretty serious dental issues that just I haven't been able to really get sorted out. I broke a tooth when I was in San Francisco. Went and saw a dentist there, and it was so gentle. It was just one of the best dentists I've ever seen. I was like, wow, this is incredible. And so just before COVID, I was actually going to see a dentist over there to get one of the issues that I wanted fixed.
Right.
That's going to cost more than $100,000. And I remember walking away from that thinking, I think it's worth it. Some of it's cosmetic, but a lot of people couldn't afford that.
Right.
And so that sort of opened my eyes to having a look at, well, what would happen if I broke my arm? What would happen if I, all those sorts of other things. And of course, when I travel, you normally get travel insurance. I always will have travel insurance. Now, that's normally included on your credit card for free, but I trust that. So I'll always go and buy an additional cover anyway. And because I travel frequently, I get a worldwide multi-trip cover. And you actually have to specify whether or not you're going to include the United States. So it's the whole world, except for the United States, or you can pay a surcharge, a premium, which is normally about double the insurance, to also be covered in the US.
I had no idea. Yeah.
And I thought there's something seriously is very amiss with all of this. Then I, of course, went to the US and I actually looked at what is the price of health insurance in the US. And I was comparing it to what you'd pay back home. And I was comparing the top cover from, I think it's Blue Shield. And it worked out to be, for the absolute top cover, it worked out to be something like, for a family of four, would be like $2,000 a month. I thought, that's a fair whack of money. But what it covered was quite significant. But that seemed quite large. What's very interesting was that if you're not a US citizen, you can get international health insurance, which is for expats, which gives you the choice of provider anywhere in the world. And it only comes in at $10,000 a year. And the Blue Shield one came in at $24,000. And I'm like, there's something just seriously not right with all of this.
Right.
So I think when it comes to whether or not it's hopeless in the US, I think if the US looks at other countries, it'll find a solution based on what is actually already the system that you have. So rather than these really radical changes, and I don't want to get into politics too much here, but just if we think about the last two presidents prior to the one that you have now. So of course, Obama tried to introduce Obamacare. Great idea. It sounded really good. It just didn't quite come out, I think, the way that he would have hoped. I think there's a lot of people that were unhappy with, their costs going up or various things. But it was a great idea. He was trying to create a bit more of an Australian-style system, I think, was what he was trying to do. And then Donald Trump tried to take on the big insurance companies because, he's going to fix this all on his own, Donald Trump. And look, I think he had a good effort. But it was the same thing. It just wasn't going to happen. So I think insurance companies, their power needs to be reined in. And I think that would happen by opening up the US market to more international competition in this region. But I also think that the AMA has a very, very big, part to play in this. And they have a lot of responsibility. So we know that they spent hundreds of millions of dollars to get medical schools to reduce the number of graduates that were coming out of those schools and to actually reduce the amount of students being admitted in the first place. So I don't think it's a coincidence that the US has approximately double the healthcare costs as a part of the GDP of the country as most other OECD wealthy Western countries would have its peer group, but it also only has half the doctors per capita. So
a lot of the doctors, they don't think that they can, it used to be a profession you'd go into and you would become, financially secure. And now they're fighting the insurance companies on their own. And so some people are just dissuaded from going into that field. So there's a combination that you described one aspect of it, and that's another. If you can't...
Look, I think that there's something to be said for that. And of course, medical malpractice is something that doctors always have to be very distracted by.
Right.
I've got a lot of friends, and I think Jim, that a lot of my family members are actually in the medical field. Mm-hmm. I'm the only tearaway that didn't want to go into medicine and decided to go into finance, but a lot of my family are in medicine. And I know a lot of doctors who I look at what they do, and I'm like, you're not even treating the patient. You're just filling out computer paperwork on the computer, and they're like, because we have to document all this stuff.
Yep.
So that we don't get sued later on. It's like, but surely healthcare is suffering as a result of that. So look, maybe what we can do is to consider having group medical malpractice insurance and absorbing some of the cost of that where it is something that is, a genuine mistake, because everybody is human.
That's a great idea. Yeah.
But I'd like to come back though to the whole insurance thing issue that you have in the US. So on paper, it actually sounds like you've got a reasonable system, right? On paper, if you didn't know anything about the US,
right,
it actually seems okay, right? You've got health insurance for those that can afford it, and everybody else is covered by something, right? And so you go to a hospital and they are required to give you life-saving treatment. But it's only after you scratch the surface of that you realize, and you hear about cases, and I think you and I have discussed this before, where, and I think Law and Order actually did an episode on this, where, a kid comes in, 19 years old, isn't insured, with a broken leg, and it's going to cost $30,000 to amputate the leg. It's going to cost $50,000 to fix the leg. So we're going to amputate the leg, and hey, it was life-saving treatment. I'm not sure I'm aware of any other Western country where that would even be, where money would even be a consideration.
Right.
And that's a pretty sad reflection. But if you have a look at Australia, where we have a Medicare system, universal healthcare essentially, what they did was they allowed people to, additionally to that, to have private health. And the problem with that is that because the private health is actually paying more, it means that those people are effectively jumping to the front of the queue, and other people who are in the public system are then made to wait. And so some people might only have to wait a week for an appointment, and somebody else has to wait 18 months. That's not a good system when you've got an aging population. But then if you have a look at some of the universal healthcare systems that you have in the US, for example, VA, I hear a lot of stuff about the VA where they haven't provided the sort of care that people would expect the vets to have received. So, yeah, something's not working. I think that you should look at a country like Switzerland. Switzerland basically requires everybody to have health insurance. What they do is, if you can't afford to have health insurance, they'll pay for it for you. But there's also some regulations, and I would highly recommend that the idea of private health insurance with a high level of regulations over what those insurers can do. And the reason I come to that conclusion is I look at what's the existing infrastructure of the US, and I also look at what is the complaint. So the complaint in the US is healthcare is too expensive. Well, I sort of address that in some way with the doctors, but healthcare is too expensive, and not everybody has access to it. Right. So those are the two major ones. On the other one, that's a major one, is that because health insurance can become quite expensive if you end up developing some sort of illness or disease, it can force people to stay in jobs that they don't want to be in because they can't move to a different job.
Absolutely.
And that, of course, would mean that, in some cases, if you're a small business owner or something like that, you can find yourself going bankrupt, and shouldn't go bankrupt because you're sick. That's
absolutely not right.
So you look at those issues and you say, all right, well, what would be the logical solution? I don't think universal healthcare is a very good idea for the United States. I think you have too big a population. And I don't think that the government is, especially in the US, and because of the size of your country, it's not really because your governments are, particularly more inefficient than every other country's government. It's just that you're such a big country, both in landmass, in size.
Yes.
It's a difficult thing to run. And so I don't think universal healthcare is going to do that very effectively or very cost effectively. And I think it's just going to make the same situation worse that you've complained about, which is the lobbying by insurance companies, the lobbying by healthcare providers, etc. So I think that the better way of doing it would be to make it more private, make it highly regulated. So, for example, in Australia, if you are between the, I'm slightly making this up, if you're between the ages of 35 and 38, your health, and you're a male, your health insurance is going to be X. If you're a female, your insurance is going to be, whatever it is. If you're between the ages of 21 and 25, then your insurance is going to be whatever. So they treat everybody in buckets, in age buckets, as opposed to your individual health circumstance. That means that you can't be denied health insurance, okay? But it also means that you're not going to have to pay an exorbitant price. The other thing that they do is that health insurance really can't. I've never heard of a health insurer declining to pay for something that you had while you're in hospital. Okay, so that's something that I would highly recommend the US actually introduce, which is that they introduce some kind of government-run clearinghouse, so that the government can actually say, no, this was covered, and send the bill to the insurance company, and also to require the insurance companies to make payments to providers immediately, because that's another thing that providers don't like is,
right.
doctor, I've done the work, and that $100,000 I charged for heart surgery didn't all go to my pocket. I had to pay the anesthesiologist, I had to pay the nurses, I had to pay to the hospital room, etc.
And there's always delays in getting that payment. Yes.
Yeah. So I think that would work really well. Now, I think that you would have to, drag the insurance companies that you have in the United States kicking and screaming to that meeting.
Absolutely. Right.
But I think that if you simply said, look, you guys don't have to change at all if you don't want to, but we're going to open the market up and let international insurance companies come in and compete. And take a company like Bupa, for example. I'm not sure if you've heard of Bupa,
Yep.
but it is actually a not-for-profit. And a lot of the major health insurers throughout Europe are actually not-for-profit organizations or member-owned organizations, same as Australia. I have nothing against the for-profit ones. I think they offer a very good service. But, a lot of people actually say, I don't want someone making money out of this. I'd rather be in a not-for-profit one. And they can do things as well. Like they can spend their money to build, aged care facilities. So for those people that are getting a little bit older,
Right.
because the insurance company is actually building the facilities themselves, it means that you're able to access that care at a much more cost-effective price and at a rate than if government was to try and do it for you. Does that make sense?
It does. And the one thing that I'm concerned about, you actually kind of addressed it when you said you don't make the universal healthcare, because whenever we look at a country called like Switzerland or Sweden or some other country that has some sort of universal coverage, then you hear the word socialism, and it's dead in the water. You can't talk about it anymore rationally, So this is again is a political constraint. It's not a rational constraint. But by privatizing it, you sort of take away that socialism kind of knee-jerk response. And so if you privatize it, but make sure that everyone is covered, I think that makes me feel more optimistic. You're starting to change my mind a little bit about this, because, the privatization takes away the resentment of the government doing it and the socialism argument. But the heavily regulated part of it, which people will complain about and squawk about, but that's okay. We complain and squawk about many things. And so, if you can regulate it so that it's fair, and that people that do not have to go bankrupt when they face a medical emergency, that they do not have their lives turned upside down because of illness or catastrophic consequences of an accident or something like that, then I think people would be happier with their healthcare system. Now, I'm not sure. I haven't thought this through. This is a new idea for me, because I've always thought of, our system versus universal healthcare. And with the Obamacare, one of the problems it ran into was, even though it was going to cover the costs, there was this idea that states like Texas, for example, didn't do it, even though the government would pay for it, because they cried socialism. So you get this problem with the government trying to do it. But if you do privatize it and open it up to competition from other countries, I'd see a way forward in this country. I don't know why I haven't heard this idea before, or have I just been not paying attention?
To be honest with you, I don't think I've ever heard anyone talk about it like that either. And I'll tell you where it actually happened for me was actually in California, a place that I think you've heard of once or twice. I remember I was in California, and I'd actually just come from Switzerland, and I saw this big sign and it said "Healthcare is a right." And I didn't know anything about California at that time. So I was like, oh, yeah, the lunatic socialists in California. I know.
Yeah.
And then I sort of looked at it and I thought, oh, hang on a second. And I went to a couple of other states that are poorer, shall we say, and less developed than California. And it was sort of like, to me, it was like, oh, this is what that sort of right, the right-wing free market, no government, no socialism is all about. This place is terrible. Look at how backwards this is. So I kind of revisited the issue and I thought, yeah, no, something has to give. And I thought, would I want to live in a place where, a child would be injured and there's no mechanism for the social responsibility for helping that child? No, I'd rather pay some taxes, actually. And then my right-wing friends are like, you're such a socialist, Shaquille. I'm like, no, I'm really not. But, I think what we have to recognize is that most countries on earth have a capitalist economy.
Yes.
But you have socialized services. And there's a difference between that and socialism.
And
I think that conversation gets very muddled up in the US because I hear people in the US say that they're socialists and they're really not. What they're talking about is they want more funding for social services. But then when you drill down on that, it's not actually necessarily even more funding for social services. They just want people to have access to them. Right. So I would say I'll say a couple of things here. One, I'm not sure that this would be fixed immediately by the federal government trying to do it. But it could be fixed in a place like California, for example, because California tried to have universal health care. So if California said, look, this is what we're going to do, I think you'd get a lot of support, even for the 40% of Californians that vote for Republicans. I think that you would actually get a lot of bipartisan support for an issue like this, of saying, look, let's try this, let's see how it works. Now, there's a few things there. The initial costs are going to be quite high because there's a lot of people who are very far behind in accessing mental health care. We know that. Absolutely. We also know that the people are very far behind in accessing drug and alcohol abuse care, right? Yeah. And so if everyone's covered at the same time, there's going to be a delay. Yes, you've got the book right there. there's going to be a bit of a delay or a little bit of an overburdening of the system for the first little while because everyone's getting enrolled onto this new system. And it's going to take a while for the facilities to be built.
Ramp up, yeah.
But after that, then you have a sort of slow and steady, amount of patients accessing that care and et cetera. And things then start to improve. And that's another thing that I would say is that when you put it in private hands, the health insurer, like my health insurance here in Australia, for example, will actively encourage me to give up smoking, including subsidizing the cost of patches and treatments. Now, I enjoy smoking, so I haven't really taken them up on that as yet. But they also have attempted to access or attempted to subsidize the cost of me going to the gym so I can lose a bit of weight. And my point being, the health insurer, most people don't change them that often, right? Yeah. So they know that if you can live for a bit longer, it means that they can delay the costs of having to deal with your lung cancer or your obesity-related issues or whatever it may be. And it's healthcare as opposed to what you have in the United States, which is sickness care.
Yes, absolutely. I couldn't agree more. And the differentiating between socialism and social services is a very important distinction to make. And I have long said that we're about sick care rather than health care because we're not proactive in this country about taking care of people. And I had not heard of, being incentivized to quit smoking, because when I quit smoking it was rough, but, it was like, it was up to me.
Well, you know what they did in Dubai? The person who lost the most amount of weight over a certain period of time got like an ounce of gold or something that they were giving away as part of their promotion. But the other thing that I'll say, I saw this video, and it was a very short video. It was like a TikTok video, but it was before TikTok, and I thought this is what our movies, Hollywood, and all that should do, because we often see the sort of decline of a person, and we tell this really horrible kind of story to try to evoke emotions in the audience. Yeah. I know you've had some experience in filmmaking and books and all that. We tell that story to try to evoke the emotion of empathy in our fellow human being. I think we've lost for a while the message of hope. I don't think we often are so critical of our society, and we're so critical of the other side. That's why we're so divided. That we forget to actually give the message of hope of, okay, well, how do we get there? And one of the things I actually saw was this, you know, the on the billboards where they have ads like meth not even once, and they show like a person, you know, a person's mugshot, and then 2 years later, and then another, and you just see this really horrible progression.
Right.
It's probably an effective ad. I mean, it gives people, I think, pause for thought. To go,
yes.
Maybe I shouldn't do that. Well, this was actually something that happened in reverse. What they had done was they followed a person with quite a severe, you know, drug addiction, you know, junkie, whatever, needle marks, you know, the scabs on the face, all the stereotypical stuff, and they actually showed that person 2 years later and 5 years later.
Healthy.
Got their act together. They were working. Their skin had cleared up. So a lot of people are really worried about all the, you know, the scars and things. Their skin was all cleared up. They could see properly. Their eyes were clear. They looked healthy. They looked happy,
Yes.
right? And that's a message that is rarely told in the media. So I think at the moment, tackling the healthcare crisis, it's all about, from what I can see in America, it's all like single. I mean, I saw this argument between two people. I'm not picking on California, but this has happened to be where it was, between two people arguing about whether it should be single payer or universal. And I'm sitting there listening to them going, neither of you have any idea what those two terms mean. What's wrong with multi-payer universal healthcare? There's nothing wrong with that, right?
Mm-hmm.
But anyway, so instead of having this kind of attack on these are all the problems with the system, it should be more about, if we initiated these sorts of changes, this is what our future could be. What do you think? And where are the problems? With what I've outlined, I'm sure there's a few issues there that you'd have to work through.
Of course.
But I think that that's a much more hopeful view of healthcare in America. And you know what? If you're the greatest country on earth, I'm sure you could do it. Everyone else has been able to.
Yeah, that's one of the things that's frustrating about it, is that if this country does put its mind to something, it can usually accomplish it. And so and it's a lack of political will right now. But, California has been, although it's much maligned in many ways, it has been the innovator, and often taking the first step, and then the rest of the country following. So, this is a tremendous idea to try it out here in California, and then see if it works, if it can make it work. And then that would be inspirational to others. But the message of hope, which is the message in this book that I'm pointing to, is that is the thing that because we have to have a message of hope, because this doesn't have to be something where we throw our hands up in despair. It is something that we can tackle. And it's not as hard a problem as putting somebody on the moon, and we were able to do that in a short amount of time when we got motivated. We changed our school systems to emphasize math and science, and these types of things, change the society. And if we start to say, hey, look, it's not dog eat dog, every man for himself. It's a community that we're involved in, a society that we're all part of. And we want our fellow people to have as comfortable lives, to live with a quiet life of dignity rather than one of despair. And it doesn't make me feel better if someone else is doing worse, and this is the kind of thing that the optimism, and I have been suffering it. I said it at the beginning of the show, I've been just almost in despair about the chances of changing the healthcare system. And I really appreciate you coming on with this message of hope and some practical ideas about how to change it. And is it achievable? Neither you nor I know. But I think if we can summon the will, it could be done.
Oh, definitely. And look, even if California's too big a state, look at Vermont, look at New England, you look at some of those smaller states that are run by Democrats, or even actually some of those states that have gone really badly, like Kansas, that are run by Republicans, and go, hey, what do you think about more competition?
Yeah.
You know what I mean?
Yeah.
So,
that's exactly right. The idea of competition is fundamental, and I think that, like you say, even it doesn't matter what party you're from, or whether you think of yourself as conservative or liberal. And no one's really against Constitution as long as the playing field is fair. And I think people can get behind that. Well, Shaquille, I'm running out of time, but I really appreciate you coming on with this message of hope. And I'd like to talk to you more about this because, I have Congress people that I could write to and make these suggestions. And, who knows, it's got to start someplace. It's the first time I've heard some of these ideas, Shaquille. Thank you so much for joining me today.
Thanks for having me.
Okay. All right. That was Shaquille Latimer with his message of hope about our healthcare system. And he changed my mind. And that's what the show is about, being able to change your mind about something. Don't dig your heels in. And there's no change without change within. It's inside ourselves where we begin. It's not our brains. It's not our hearts. It's deep inside where it starts. And don't forget, every weekend is a new beginning. So thank you for